You're okay.
I think we'll be getting started in just a minute here. So if you want to come in and get yourselves settled, that would be great. But welcome everyone. It's fantastic to see all of you today. It'd be such a meaningful day, and I'm really looking forward to it. I'm Dr. Benjamin Peterson, in case you weren't here last time, and I'm just so excited to see you. We'll start in like 30 seconds.
Good morning all and welcome. I'm Jeff Abernathy. I'm the president of Alma College, and perhaps for today more significantly an English teacher who teaches environmental education. It is heartening to see all of you here for the anniversary of this disaster. I think it's heartening that we all come together in an overflow crowd to remember a disaster. We're to be downtown in our opera house, and instead we are here because so many expressed interest. But a critical opportunity for us to reflect on the meaning of the disaster 50 years ago, on the importance of our ongoing work. The work we will do these 2 days will help to ensure that such disasters do not happen again. Our partnership at Alma College with so many across the community has been incredibly valuable for generations of students and faculty at Alma College. I'm so deeply grateful for all of those who led that work. Many are here. And I particularly wanted to recognize as we start our community action group, the Pine River Superfund Citizens Task Force. Many members at one point or another of that group are here. You are our heroes. You are the ones who worked through these decades to ensure that, yes, $500 million was invested, that these became Superfund sites in order to clean up this community, in order to better model how communities can respond to disasters of this sort. Would you all please stand, any member of the Community Action Group, so that we can recognize you? Thanks to each and every one of you and all of those who could not join us or who have gone on. Your work inspires every one of us here at this conference and many beyond. Well, thanks to Dr. Connis for her keynote last night that challenged us to think about the historical context for disasters of this sort, and that will be resonating throughout the conversation that we're going to have today. Ed Lorenz is our professor. I think he's still out here signing books, but also a member of that community action group. Ed's story is fascinating. He came here as a first-year professor and didn't know about the disaster down the street, but learned of it when, as I recall, in Boston, he had a conference, Maryland, is that right? And the speaker said, well, you're from Alma, so of course you know about this disaster out of the street. Ed came to know much more about that disaster through the community action group, through his work over decades, through his work with students, and Ed has inspired us at Alma College to be more deeply a partner in this community through certainly this work, but much more as well. Indeed, that work inspired us to partner deeply across Gratiot and Alma. Today, where we were to be, the restored Opera House houses students in the middle of the downtown, in part because we recognize how critical partnerships are with our community and how we can thrive together through these deep partnerships. Indeed, last year we started the Center for Community and College Engagement, which is modeled on the work that this partnership has developed over many decades. This is the work of a liberal arts college like Alma College. Wendell Berry said it. He said that the work of college is making humanity. And in making humanity, we help to sustain democracy and sustain communities. That is the work that the Community Action Group has done through these many decades. That is the work that we are all engaged in here today. Thank you for joining us for this conference. I look forward to the conversations to come. Welcome.
Thank you so much, President Abernathy. issue for years, decades in some cases, and have a lot to say. I know you'll have a lot of questions for them. But first I'll just do quick introductions, and then I'll ask sort of each panelist to quickly talk a little bit, give a sort of opening statement, and then we will have a lot of time for questions, which I hope we will have. So first of all, we have Tom Alma. Tom is a chemical engineer, and he has been the manager of the Superfund side since 2008. Next we have Diane Russell, who has been the community involvement coordinator at the site, the PBA, since 2014. And we have Liz Braddock, who has been a health official for the Mid-Michigan District Health Department since 2021, has been working in the department since 2017. Corey Gretsch, who works for MDHHS in environmental health, has been working with them for 20 years. And finally, Edie Clark, who was a staffer for the House Democrats in Michigan during the critical period of the crisis. So join me in welcoming our panelists.
Hello, everyone. One of the things that strikes me, I guess, a couple of things I always thought about with the well cells, and then obviously kind of the remediation site. Can't hear? Nope. Now? Yep. Okay, got it. Thanks. One of the things that always struck me, I guess, since 2008 when I came onto the site was, how did this happen in terms of the least clean? And one of the good things, I think, when Superfund first came in 1980, we learned a lot since then. Stuff that we do now is not done in 1980. Big mistakes were made. Certainly the remedy in Valsicol was, it's a failed remedy. It hasn't worked. In addition, not only that, we gave Valsicol a pass on all the contaminated sediments. And so now I look at that as someone I came into the EPA in the late 80s, and I still look at that and go, just how much we've actually learned since that time frame, which is good. I think another thing that we're extremely happy about at EPA is the bipartisan infrastructure development passed. The amount of money that we're getting, for example, we realize we're getting probably $55 million this year. Next year, I expect us to get probably $40 million. And even if that money ends, okay, because it's eventually going to run out, it's $1.5 billion, I don't know the exact amount. The good thing happened a few years ago was the Superfund tax was put back on. The Superfund tax is a tax on oil and gas that initially started Superfund. That's how they called it, Superfund. And so what happened is in the mid-90s, that stopped. And now that tax has come back, which is going to help us and certainly help us with accelerating cleanups not only at the Valsicol site, but other Superfund sites. So this summer, we'll be starting the Valsicol burn pit cleanup site across the Pine River. We're continuing to excavate this year over 100,000 tons of contaminated soil for offsite disposal. We have additional remedies planned for next year, including excavation of floodplains and stream banks downstream from the St. Louis Dam. We have obviously more design work and more construction work to do in the future, but we're extremely pleased with respect to getting this money because money gets it done. And we've been struggling for years and years getting only a certain amount of money, but now I think we feel really optimistic about moving this cleanup forward. And also, we're actually going to begin discussions with all the stakeholders, including the City of St. Louis and Pine River Citizen Superfund Task Force and Tribe about the redevelopment of the site. Because we're getting to a point where we need to start talking about that because design requirements need to take redevelopment into consideration. So I'm extremely happy and I'm glad that we're moving forward with this cleanup at an accelerated pace. Thanks.
Thank you, Tom. Good morning, everybody. Diane Russell. I'm EPA's Community Involvement Coordinator. And as stated, I was at had the privilege of working with this community on the Superfund project since 2014. Prior to that, though, this was actually the first sampling job that I ever had as a contractor, was the Belsicol site doing water sampling. So that was back in 2005. So I've had quite a history with this site and working with the community. And I'm also, unlike most of my colleagues who do come from the Chicago office, I am a native Michigander who continues to live in Michigan. We have a field office in Flint. So I think one of the things that, you know, I have the privilege of kind of providing perspective on this panel this morning is my work in community and how that experience has not only informed the key elements of how we do our work and how we communicate about our work, but it's also informed other work that I've done across the state. I've also worked in communities in the Flint water crisis, the Kalamazoo River sediment cleanup, the downstream in the Dow site, Tittabawassee River. So several communities in this state, and a lot of my work and experience is informed by the work I've done here in St. Louis. And I think one of the key things that is certainly that we have at our fingertips now is the resources that we have to help drive, bring in community-driven solutions to these problems and elevate those. Because while I'm a community involvement coordinator, I tell folks at EPA all the time, I am not the expert of this place. That's where community is, and it's always important for us to find ways to have that seat at the table. Just like we create a seat at the table for our engineers and scientists, that community expert, we got to make resources available and provide methods to maximize making sure that we have that seat at the table for community. So I've had the privilege of working across the state and also more recently in East Palestine, applying those frameworks of community engagement that is focused on community-driven solutions and methods that really help us communicate about the science that we're doing and elevate the needs that people have so that we can meet them better. So that's really the role that I play, and I look forward to the questions that you bring in that perspective today. I hope to answer. Thank you.
Hi, good morning, everybody. My name is Liz Braddock. I also lost my voice this morning, so I'll do the best that I can. And I also have an accent, which put those two together are very difficult to understand sometimes. As I said, my name is Liz Braddock. I'm the health officer for Mid-Michigan District Health Department. So I'm the health officer for Gratiot County. I work in public health. Myself and my team are the boots on the ground here in Gratiot County. We have an awesome office in Ithaca. And every time that there is a public health emergency, a public health declaration, or even an event, public health is involved. As boots on the ground are involved because we have clinical support, we have sampling support, we have an environmental health team. Unfortunately, when this issue event happened in St. Louis, public health wasn't part of that initial discussion at the time. That has changed now. We are always a part of the discussion moving forward. And I think also when public health here in the Gratiot County, when we are looking at working on an event, we have community partners from day one. And when I talk about community partners, I'm not talking about state partners or federal, we're talking about those in the community who want to assist us, and that is always great. And I feel that social media and just the media in general has elevated some of the issues with environmental injustice and health equity, and those are some of the issues that has impacted this site. So I appreciate the opportunity to be here today. Thank you.
Good morning again. Appreciate you here. Thanks for the organizers for putting this together. So we got Corey Gratchen, the Department of and Liz and I are colleagues, and Liz is spot on. Today, you're so much better off because of having local public health, and it takes state and local together to respond to these sort of events. So, if you go back, it wasn't my colleague, or was my colleagues, but not me, right? And so, if you go back to that time, the questions then and now, when an incident like this happens, are the same. And the first one is ending that exposure, right? So it was wanting to see that any additional exposure stop. And then the next was the concern that people are going to suffer an immediate adverse effect and going to end up rushing to the hospitals because it was a statewide exposure to a hazardous chemical that should not be in the body and could cause harm. And so, fortunately, that step didn't happen, right? Like, you didn't see that. But then in '76, the State Health Department, the CDC, and researchers like Dr. Marcus, she wasn't there in 1973 to be clear, but is today is our champion, honestly, at leading the research that goes still on today. But at the time, that partnership came together. The health department started creating that list of who was exposed. And it really allowed them the question to be asked, these public health questions to be asked, which is who was exposed, how much were they exposed to, and was there harm? Now that last question is extremely difficult. And I realized that if you were part of that exposure, what level of frustration, I can only imagine the level of frustration I'm like, why can't I get an answer? And it's complicated because at that time in history, in the 60s, in the 70s, in the 80s, everyone in the United States, we now know, was exposed to PCBs, polychlorinated biphenyls, and chlorinated pesticides. And when you look at those, and then if you were here in Michigan and got exposed to PBB, that adds on top of it. Now you have this mixture. And there's been years and years of study. And what you find is that those chemicals affect the same health endpoints. And so it's you know, the things we can say is there are studies that find association between PBB and measures of harm. You can say it for PCBs, you can say it for DDT. What's hard to do though, because it's just not that precise, is to be able to go down to the individual, right? To be able to go to an individual and come to Corey and say, Corey, what's your health outcome going to be from your past exposure? Or somebody with PBBs, but what's your health outcome going to be? Science is going to fail you. Science has limits. And then if you have a disease, if you show up at the doctor's office and you have cancer, right? The doctor is going to treat the cancer. They're not going to be able to say, why? Was it, you know, which element in your past, your genetics or your environment, resulted in cancer? So, complex questions. But the health department today, we still are working with Dr. Marcus. She's taken on leading that research, putting together a current cohort, and we're pleased to continue to be in that collaboration. So, you know, my colleagues were there at the beginning, and you know, Liz and I are here today, and look forward to the conversation.
I would also like to thank all of the people who are responsible for organizing this event today. It came as a wonderful surprise to me to hear that it was going to take place. I can tell you that 50 years ago when I was working on this issue, I had no idea really what was happening at that time. But I certainly would never have guessed that 50 years later we'd still be talking about it. I also want to acknowledge a couple of people out here sitting at the tables. Mr. Fred Fry and former State Representative Bus Baniola. If you could please stand up, I would appreciate it. anybody we could find in order to gather information. And that brings up an important piece of what I'd like to say today, which is, it's unofficial. It doesn't sound, it may not sound important, but I can tell you that it's one of the most important things that I learned during my hustling around trying to gather information. And that is that the truth sometimes does not come through our door wearing a three-piece suit. And it doesn't come through our doors always in designer clothing. Sometimes the truth is buried underneath appearances and under expectations that we place on people in positions of authority. So as communities, as states, as leaders, as politicians, as bureaucrats, we need to learn to listen to the people. And that's what Fred and I did. And then we took it to us. And if there was ever a perfect candidate to listen to the information we had gathered, it was Busby Miller. And I can tell you that without the work that he did, together with other people who cared, with the farmers and citizens who had nothing to do with the issue other than having a personal interest in seeing something happen correctly. And if it hadn't been for people like that, this group might not be meeting here today. I'd like everybody to really take into consideration the reality that most of the good information we got in the early stages of this crisis did not come from state agencies. And I also want to point out that it came from farmers, and it came from their children, and it came from the people who were disabled, the people who had shot their cattle out in the pasture, even if they could legally have marketed them and sent them out for human consumption. These are things that we need to keep in mind, that don't leave the public part out of public health. So that's the most important thing I have to say. And I would also like everybody to understand that this panel was put together in hopes that we would have a group discussion. So please do feel free to ask questions.
I don't think I can do a better introduction to questions than that, but we would really love to hear from all of you, hear what your questions are, hear what your comments are, hear what your thoughts are. We are working on one remote microphone, so I have a mic runner here who will run it out to you and then run it back. But does anyone have any questions?
I guess this question would start with Tom, but I'm interested in others as well. Is that close enough? There we go. I'm curious about redevelopment. I work with the Michigan Department of Natural Resources, and we've looked at contaminated property and what its value is and what its use can be. This property is so contaminated, even with all the work that's there. Do you see any residential possibilities of this, or are you thinking solely commercial, or are you thinking maybe a big tombstone remains in the next 100 years?
We would look at this as recreational, no residential. The remedy consists of many multiple components. Actually, back in 2004, EPA hired a consultant to start working with stakeholders on the redevelopment, what could be the vision of the actual site. Portions of that site are going to have to be fenced off because we're going to have a very large water treatment system there. But there's actually going to be a cap that's put over the site that you can do redevelopment on, particularly recreational. So actually recently EPA has brought back a contractor to start working with stakeholders to talk about that, including the city of St. Louis's Park and Recreation Department. So there is possibilities. The big question, obviously, from an EPA standpoint is who's maintaining the site. Obviously, maintaining that site, maintaining that cap is extremely important. And as I said, there's going to be portions of it that will have to be fenced off just due to the remediation and there's a large portion of the walkways along the river, things of that nature that I think we can do. And one of the things that is important for us is as we move forward and get additional funding and we accelerate the cleanup, our design engineers need to be able to understand what redevelopment will happen so we can design the remedy for that. So it's all, back in 2004, it was interesting, I got a quote from the city of St. Louis's Chamber of Commerce head, Phil Hansen, and he said, well, we always thought that was just pie in the sky stuff back in 2004, and it's actually going to become a reality, so in any case, we're excited about that.
Anybody else?
I will just say that I think this is actually a conversation Diane and I have had, just as a vision on that site. That wouldn't it be great if one day there was music playing, right? And maybe like a festival or something like that. Just be sort of a beautiful thing. Maybe one day, Other questions that people have?
Hi, my name is Jennifer Newman. My family was personally impacted. I'm a chemist, currently stay at home Alma. I grew up near Hilda and Al Regan in Chase, Michigan, and no one knew about this, and still don't. Sorry, I get emotional easily. And I had spent a lot of time informing people my age. I was born in '81. Why they're sick. And I'm just a chemist and a stay-at-home mom, and I don't know why I'm the person doing this. And I don't know why people my age don't know about this, and I don't know how to get it out there more than I already personally am. I have a friend who is a nurse in the chemo department, and she sends me people. I probably get 3 or 4 people. And it's almost like a counseling session with these people because they have no idea why their families fell apart in the 70s. And it blows my mind that there's not more, and I don't know how to do more. Like I said, I'm impacted. I have ADHD, I have an autoimmune disorder, and I get migraines constantly. So I struggle to stay consistent and follow through and make large action happen more than a one-on-one kind of conversation. So one of my questions, that was more of an introduction, is one of the thoughts I had was trying to map out where all the cattle were buried. I just wonder how important it seems. I know there's a PBB farm, and I just watched them build a house right where the barn was at, and I had nothing I could do about it. And then someone passed away across the street within a month of it getting. So I just wonder if that is something that seems important. It's something that I feel like I could personally follow through and try to help. I've talked to so many people in my area, and I know where a lot of the cattle are buried. And then I also just wonder how we can inform health officials more. I was recently just told that I need to eat fewer calories because I have self-induced hypothyroid. I literally told the doctor I have an autoimmune disorder, and I bring the wonderful handouts to every doctor's appointment I go to. And they weren't listening. They still weren't listening. And it's really frustrating. So on that appointment, she still finished and said I had self-induced hypothyroid and I should decrease my calories. It's infuriating, and I don't know what to do or how to help more.
Thank you for sharing that story, which is very impactful. So, here in the health department, here in Gratiot County, when I look at my mission, my mission of the health department is that we take action to protect, maintain, and improve the health of the community. And local public health, we try to do that, and we are restricted by resources, by policies, by procedures. And even yesterday, when my epidemiologist, Norm, did have a voice, I did actually speak to him earlier yesterday before, and he said to me, just as you said, why don't people in Michigan know about this? And myself, I have worked in public health. I've been an environmental health inspector since 2002, and not one time was I taught about this site. And I would say since then, and again, history teaches us, but since now, I would imagine that every person who's going into school for environmental health and public health, they know about the fringe water crisis. They know, so things are changing. It doesn't help the situation of the St. Louis and Velsicol on the map, but I think that we are changing. There are efforts with our community, with our local colleges, the state colleges, to bring this to the center of attention. I think so too. And then, since this panel was talking about policies and procedures, in the state of Michigan, if the health department is summoned out to do some testing, water testing, and there's a drinking water well, and they have elevated chemicals, and PBB isn't one we test for, but if it was, let's say, an elevated, maybe benzene or arsenic, we can talk to the state, and we can work with the state to get restricted covenants put in it, so that location, let's say there is an existing house, that location cannot be changed into a daycare, or that location cannot be sold to the next people who may move in without it being notified that that house has an issue with a drinking water well. Again, it doesn't help you, but I feel that the issues that have happened in the past are now making changes in the way we look at environmental health. And also, there are a lot of efforts right now to put environmental medicine at the front line of what is being taught at the med schools. And we are always welcoming, we are also welcoming medical students and nursing students from our local colleges to come in and shadow our staff so that they can see what we do, and we bring this as part of it. So if you have a medical person coming into the health department, they don't want to just see the clinical side, they want to see what environmental health does, they want to see why we do a restaurant inspection, why do we do drinking water standards, so that you know that environmental impact does impact health. So thank you for your comments. I hope that helps.
Thank you. Yeah, thank you again for sharing the story. And I think you put your finger on a really an area that we all need to work on, public health and environment in general, is this. So I applaud you for having that conversation with your doctor, right? Like you've heard, so there are a number of, as Health Officer Braddock said, there are programs trying to bring environmental health as a more recognized part of medical training. I think the other part is how to. There's so much information people can pay attention to out there, right? So even though you can go to the MDHHS website and read about the history of the PBB, incident and what our role was, our work with Dr. Marcus and other researchers, you can go to the EPA website. Like it's out there, but that's really not obviously penetrating down to an individual level. I think today, as Diane alluded to, we're much more cognizant of, number one, being in the community and working very hard to get those who would experience the chemical exposure at risk from it, right, to be aware. The challenge with PBB, of course, back in the day, it was, as you heard, it was well known. It was a major issue. It was national. I don't know if it was international at the time, but okay, I'm going to let you speak next. I'll hand it over. But it was, it was really, really a big deal, and it, I suspect, drove forward a lot of informing the 1978 Public Health Code that still is a very, very good set of legislation. I mean, here in Michigan, I think our public health code, compared to other states, is well written and allows for that sort of collaboration with regulatory agencies and public health to work together. It also brought an ability to do research in a way that it created this Research Protection Act. And it allows for being able to do research in a way that protects, a person's personal privacy, so that they can feel confident they can share personal information, and then that can come together, and we can work with like researchers like Dr. Marcus with Emory University to try to understand, right, what was the impact or the potential harm. So again, I just applaud you for having that conversation with your doctor. I think that's really wonderful. To the question, so you asked a very specific question, where were the cows buried? I would have to go back and talk with our colleagues at the Department of Ag. It's really a multi-department effort back in the day, and I'm going to hand it over to someone who had first-hand experience. What you'll find on our public health website is, sort of what counties, there's maps there about numbers of people who participated in farms and things like that. I don't believe we have a map on there that shows where the cows are buried. So I'll take that back. See what I learned. Okay, appreciate it.
The cows are buried in Kalkaska and Mile, just so you know. And I have some information regarding follow-ups for people who have questions and maybe aren't always getting answers to perfectly legitimate questions. And there's actually 2 answers to that. And one of them is, I would like to see somebody teach a class in how to use politics to their advantage. Fred and I were working for the House Democratic staff at the time that this took place, and the governor was Republican, and the appointees and the departmental agencies spoke to the governor. And a governor who I believe did mean well, that was Governor Milliken, listened to his state agencies. And I want to ensure everybody that what I have to say about them now is no reflection on the current Department of Public Health, where I did work myself for something like 13 years. I can't remember how long it was exactly. But the point is that because we were Democrats, we could say just about anything we wanted as long as it was true about the state agencies. So when we found out that they were behaving corruptly, and I don't use that word loosely, it was corrupt, we were able to go right straight to the president in the Michigan Capitol building, where there were over 30 different pigeonholes, and those were for all of the media outlets throughout the state. Anybody can use those pigeonholes, by the way. But we would put together press releases, and we would tell the truth about what we found, and we would put it in Representative Spaniola's name, or the House Speaker's name, or whoever we could get to listen. And that information would go out to about 30 different news outlets throughout the state of Michigan. We were communicating with people throughout the free press. Don't ever forget the power of the written word in newspapers and in press releases and in radio stations and televisions, because we made it work for us. And once again, I believe that's part of the reason that we're here today. They listened. They listened very closely to what we had to say. Another thing is, contact your state representatives. I mean, or your state senators, and then start writing letters and copy people all over the place. Spread the word, get it into Washington, D.C. If you get to enough people, someday somehow, some way, you'll reach somebody who's listening to you. And those people are the ones you want to talk to because they may have access and they may have answers. They may be able to listen to you and do something constructive to follow up with your information. I am so sorry to hear about your experiences, and thank you very much for sharing them. I know that that cannot have been an easy thing for you to do, but you are the people who we need to be listening to. So thank you very much for your help today.
Thank you. And I just wanted to add, I just want to acknowledge the communication that you've had to take on that is a heavy lift. And I'm hoping that through leveraging, so we talk about environmental justice. And a lot of times when we talk about environmental justice, certain images come to mind or certain resources or communities that get those resources. I just want to say that our agency has really put a lot into environmental justice and environmental justice resources. So with that new focus, my office has been looking at how we can leverage those resources to bring to bear here and help you with that communication. And one of the things that and getting the information out. So I think one of the things that, we're working with partners, community partners on is leveraging some grant dollars to get information out. So it doesn't end at this conference, right? So finding ways to communicate what we talk about here and make it available to folks that, maybe internet isn't going to be their source of information. How can we maybe leverage communications at farmers markets? How can we get information directly to farming communities that were impacted directly from this crisis? So we are, as we speak, trying to gather those resources, work with partners to figure out the best ways to apply that so that they are effective and it really helps you in your cause. And I hope that we continue this conversation so that you can get the most out of those resources once we're able to put them in place.
I just said that I have one more thing to say. Truthfully, I have about 17 dozen more things to say, but I can't say them all today, so I'm going to tell you one little thing, and that is, learn to count to 4, and if 2 plus 2 doesn't equal 4, do something about it. Get active in your community, write a letter, talk. The truth is the daughter of time. That's an old adage, and it really is true. So I'm going to tell you about a brief story about a pivotal moment in my experience. Like everybody else in the 1970s, I had heard about the PBB issue, and I assumed that it was being taken care of in the same way that almost all of the 9.2 million people in the state of Michigan at that time also believed that it was being taken care of. And I was willing to believe that Big Brother was watching over us. Now, I'd like everybody to take just a moment and try to put yourselves into the place of a farmer somewhere in outstate Michigan whose cows are sick and they can't explain it. The veterinarian can't explain it. Nobody can explain it. Nobody can really respond to your problem. These are people who are used to staying at home, maybe taking a vacation now and then, but I'll tell you what they're not used to doing. They're not used to going to Lansing, Michigan and knocking on doors, but they did. They left their farms and they drove to Lansing, dozens of them, and they just started knocking on any door that they opened. And somebody came knocking at my door. Now, I have to tell you that on the Democratic staff, I was about as low on the totem pole as you could go. But I was there, and somebody came to me and sat down in the chair across from my desk, and he says, I have something here that I don't quite understand. Could you take a look at it? And it was an envelope. and the envelope had come to him from the Michigan Farm Bureau. Inside the envelope was a letter to him written on State Department of Agriculture stationery. Now, what would you think if you were a farmer and you got notice about a quarantine in the mail in an envelope from Michigan Farm Bureau, who is, by the way, your insurer, but the letter itself came from the State Department of Health. Excuse me, I was wrong. That was the State Department of Agriculture. And the director who did eventually lose his job was Dale Bull, a man who had twice been found to have contamination, not PBB, but his farm was shut down due to unsanitary conditions in his dairy. So that was our state agriculture department director, and he gave Department of Agriculture stationery to the Michigan Farm Bureau so they could send out quarantine notices. What would you do? What would you do? Well, I'll tell you what I did. I went to Speaker Bobby Krim, who also deserves to be acknowledged today, and he said, okay, you're pulled off of every other thing that you're doing, and you're on this full time. And that's when Fred and I started running around all over the state, visiting farms and collecting information. And we asked everybody about those envelopes and about those quarantine notices, and how could something like that happen? And the truth was, 2 + 2 was not adding up to 4. We need to listen to the people. And fortunately, I was able to listen to somebody, and then I found somebody who listened to me. And we changed things. It was a wonderful experience for me, and I think for the people who were working on it, depending on what side of the fence you were sitting on. I will say that by the end of the political portion of this issue, which was huge, everybody was wishing they were wearing a white hat and riding a white horse, but it was too late. Thank you.
So we have our business partners here who are helping us develop this online course, and they are doing recordings. And so if you are willing to go and just answer questions, has a physician ever asked you about your chemical exposures? Or when you've brought it up, what was the response? Because we feel like if we humanize that, maybe the message will get across better. So if you're willing, you're out there and you can sign up. But we also want your voice about, Saturday we're going to ask, what do you want physicians to know about this? What's going to be important for that? So those are the type of things. So thank you so much for bringing up your concerns and sharing that. And I just want to tell you, we are trying to be responsive.
Kind of answer my question. My name is Carter Kirchmeyer. 50 years ago, I was a dairy mill based feed around. Okay? On our farm, Maple Grove Township, Bud Spaniola, I was the Evanville. Okay? And my dad went down to Lansing and, testified dad was a very proud man. And so my question goes to her is there a list of doctors? Because, I told my doctor, I was in the hospital 2 weeks ago for migraines and blood pressure. I'm a very healthy person. My mom died at 68 from 3 autoimmune diseases, and nobody would listen to her. And so, who are the doctors that we can go to? We have to have a list of doctors that we can go to that have an understanding. Yes? My doctor has in his my file that sheet from her. I was in the 2014 blood draw. Most of my family was in the 2014 blood draw. But we have to have a list of health providers that are, because they say, oh, the health insurance won't cover those blood draws or whatever. But we have to have a list of providers that will help us.
Thank you for the question. So one of the improvements that has happened over time is there are medical doctors who specialize in what's called occupational and environmental medicine. And when they say environment, it can be a little deceiving, right? Like, it's the human environment is what they're talking about. They're not talking about bunnies and squirrels or anything like that. So, happy to get, give you specifics, but there's one called the AOEC, the American Occupational, or the Association of Occupational Environmental Clinicians. It's AOEC.org. In Michigan, I believe we have like 3 or 4, so it's not a lot, right? It's a very small, but they're very, very, very expert, right? The challenge that poses is you have to travel and travel to them, so it's, again, it can be a hardship, it can be an equity issue. So to be clear, there's also a state association, the Michigan Occupational and Environmental Medicine Association, lovingly referred to as MOEMA, M-O-E-M-A. And there is the doctors who associate themselves or work in that field. So AOEC, it's like they're a specially accreditation, right? Like they've gone through a level of accreditation, and I would say have probably the highest level of documented expertise. But there are many good doctors through the Michigan Occupational and Environmental Medicine Association. But I'm happy to talk more and try to get you specifics. I think the other thing to recognize is, farmers were the ones on a statewide basis who got the highest exposure. So there's basically 3 categories. There were the workers at the Belsco plant who got exposed to a whole variety of hazardous chemicals beyond PBB. There were the farmers who got the highest doses documented for PBB, because of course you're going to eat and drink what you grow, right? Like, it totally makes sense. And then there was sort of the rest of the state who got something far, far less. So I just want to, so you're right, and your concerns, I appreciate that. Glad to talk more about those doctors.
There's another question.
I just wanted to speak to the doctors. I also have migraines daily. But I have a doctor's review about Dr. Cooper, just giving names. His wife grew up on a farm in Michigan. He's the only doctor I've had that's like said, yep, this is what I think it is. So, Cooper, yep.
at the time that the farm was going through PBB. But at that time, then my mother chose to live in California for 2 years. So I was gone for 2 years. I came back, of course, immediately in 12th grade, started living on the farm on the weekends, and then got married in June after I graduated 2 weeks prior from high school. And that was at our farm all the time. I mean, it was twice a week, every day, whatever it was, that was there. And she said to me, somehow you have the ability to understand things, you should be a vet. So I became a nurse. Closest story. Being said, I shouldn't, when I got tested, I told Melanie, I said, I shouldn't have PBB because I was in California when this all happened. And my level came back high. Because I didn't get to the farm until late 77, early 78. And there was still some exposure somewhere on the farm. My husband, at 15, because his dad and his brother would not shoot the cows, and he was not willing to send his 4-H cows that he raised since babies to have someone else indiscriminately take them in a cattle truck, I've never ridden in a cattle truck, and take them to Nebraska, put them in a pit, and shoot them indiscriminately, not knowing what kind of pain and suffering those cows would endure. My husband at 15 went out and shot over 200 head of cows with his hunting bow. That's one shot at a time. And it took forever. And he heard the shots every time he shot them. He looked in their eyes. He was devastated. I come from a town called Fremont that is one of the epicenters that this poisoning was affecting. Our church divided over this issue because there were farmers and businessmen in our church. And so the businessmen families took their church over to an elementary school for years, and the farmers stayed in the church. And they started their own church because no one wanted to be associated with the farmers that had poisoned everybody, like it was our fault. As she said, these are proud men. Fremont was run by farmers. Fremont was a proud town. My problem is today, nobody knows about this in Fremont. Nobody. I worked at the hospital in town. I can say that now because Inspector Campbell chose to get rid of 592 people May 1st of 2020. I was a communicable disease nurse, and they fired me. But I worked in town, and I went up to the OBs because this is an estrogen-driven problem. None of the OBs knew what this was. Didn't even want to listen to it. I went to the orthopods because I had to oversee the infection rates in the ortho surgeries. And I said to them, don't you believe that 40-year-olds shouldn't have total knee replacement? Tons of total knee replacements in town, in the town. Shouldn't be happening. They didn't want to hear about it. Recently, like 3 weeks ago, when this was coming up, I wrote a little Facebook thing, and I sent it to Fremont Facebook page and Nuevo County Facebook page and a couple others. Nuevo County said my content was inappropriate. Inappropriate. Fremont did publish it in their Facebook page, and basically I said, I'm
name is Christine Kalea, and I'm of Alma College. I have a few questions for the panel. So, who has jurisdiction over testing wells, and why is Michigan not testing PBB in all the wells? Who has jurisdiction over the boards and the extended medical education, and why is it not in the licensing examinations already? Because without that, patients and residents are going to be experiencing uninformed physicians and practitioners, which they'll inevitably experience gaslighting by their uninformed physicians, and also delayed treatment. Why are Michigan DHHS and other agencies like Dr. Person said earlier, focused on personal privacy when so many of us want a comprehensive study and we're electing to do it? So to map and categorize all of this exposure, especially when we know that endocrine disrupting chemicals and their dose response curves are different. So we need to follow not just the farmers, but also everyone exposed, because there's different levels of everyone's exposure and symptoms. And yeah, especially I want to know why we're not already testing for the PBB level. Thank you.
So see, we're trying to capture the questions. If we didn't get them, we may ask you to restate. So the first one, Liz and I are going to tag team. So I'm going to start with why or why not would you test well water for PBB? The first answer comes down to its chemistry. PBB is not particularly water soluble. What it does is it binds to soil. It's not going to be or expected to be in the water. So that's the first reason. Your second question about the who oversees private wells, it is not covered. Private wells are not covered by the Safe Drinking Water Act. If a person chooses to seek a permit to put in a well and drink the water from underneath their house, that is a personal choice. So the difference between a public water supply is you pay a bill, and with that bill, you get a level of professional oversight of your water quality. With a private well, you are your own water quality operator. So it is how it is currently set up. I'm not saying it is right or it is wrong, but I am simply stating how it is. But I'm going to turn to Liz because she has frontline experience on private wells.
So here in Gratiot County, private drinking water wells are permitted through the health department. And before a well is approved, we require bacterial samples, bacteriological approval, and then partial chemistry. We look at nitrates, sulfates. There are certain areas of the county, I would say Middleton as well, where we are going to be requiring arsenic sampling because we have had about a cluster of high arsenic, which is above the federal EPA level. In St. Louis, we have been doing ground well monitoring as part of a contract that we have with our state partners, where we have been testing for an array of chemicals that are linked to the site. We have been doing that probably for about maybe longer, 5 years, maybe longer, there is no detection in those wells at this time, but because it is next to a significant site, we have been working with St. Louis and the EPA to do water main extension, because, as Corey mentioned, water main extension is that is public water, and public water has much more oversight. Cost comes into it, so if somebody calls my office and says, I need to test my water for some chemicals, what can you offer me? I have a list we can offer for here in Michigan. We can go to a private lab or a state lab. Cost comes into it. Testing for lead is something that you have to pay, and then as we go deeper into the chemicals, we have to send them externally. And in the realm of public health, if we haven't got a trigger to test for that chemical, where we typically don't have a trigger because somebody isn't immediately sick if they're not exposed, then we may not advise them to spend the money on doing that. So for example, we hear a lot about PFAS right now, and we do PFAS testing. We have a contract to do PFAS testing. We have sites where we are suspecting historical data shows that there may be some PFAS contamination. If that is the case, and in Gratiot County, we have done some testing close to in Alma, close to Tulsa location. We've also done some close to the landfills. We have a plan, we have a public health action plan going into it. So when we know which wells we're going to test, we know that we have a plan before we start the project. So the plan would be, if somebody has PFAS in their wells that is above the health advisory limit, we would offer alternative water. Alternative water would be providing bottled water, providing a filter that can lower the PFAS level, or we would talk to the local municipality about bringing through community water or public water.
At the Bell School Center, we've sampled hundreds of wells, including for PBB. We just don't see it in the groundwater. I can say EPA has replaced the city of St. Louis's drinking water supply, mainly because of a DDT byproduct called pyrobenzyl sulfonic acid, a chemical. Not much studied, very soluble in water. We sampled St. Louis's actually raw water wells before we replaced it for a number of years monthly. Never saw PBB in it. So I can't say you'll never find it on the site in groundwater, but we just don't see it certainly off the site. And I feel very comfortable that we've got a handle on the groundwater outside the site boundary. Again, we've already replaced the city of sixth drinking water supply back in 2015. We're also, actually, as we speak, we just started construction with the city of St. Louis for the replacement of drinking water wells near the Bell Skull burn pit site. Not because they're contaminated, but more of as a precautionary measure. So we're working closely with St. Louis just to make sure we like to get people on city water. Okay? Obviously, some people have been fighting us because when we replace their drinking water, the city does not want them to be able to keep their private wells. They want them closed. So we have one or two homeowners that we're trying to convince to get switched over to water safe. We'd like to get them off well water, and particularly near these superfund sites. So in any case, that's on right now. By the end of the summer, hopefully we'll have the hookup of 8 or 9 homes to the city of St. Louis's drinking water supply.
I think we answered just one question. So I'm going to jump to the third question, and we'll see what we can do on the second. So the third question you asked about was comprehensive study. I think that's it's good thinking. Okay, so it's like, how can we study it? And so there's a great deal of history on that, and there's 2 things I want to share. So one is that was what in 1976 they created that list. Probably the best summary of the literature has been put together by the CDC, by an agency. It's called Agency for Toxic Substances and Disease Registry. Sorry for the long names. But they have a document called a toxicological profile for PBDs and PBB. And so they have some summary in there, and it really is a work of researchers, Selikoff, Jacobson, Dr. Marcus, you can go down the list, is the seminal research on PBB exposure, because as we know, Michigan stood out because of this, exposure. One of the things we're doing today is, and this is sort of a policy, so it's a policy question, right? An advancement that's happened in this nation. The CDC led the way, and looking across the nation for chemicals, these industrial chemicals in people's blood, okay? So you can go, they have this database called NHANES. I'm not going to get the acronym right, but they randomly sample people and they look for these chemicals. So we're partnering right now, MDHHS, with the CDC. We are running a study right now in this state to look at current exposures to these type of compounds. So PCBs and these chlorinated pesticides and PBB 153. So it's a research study design. It's not, hey, I want to test it. You do it in a very, very specific scientific way so you can say, what does the state of Michigan's population look like today with regards to 150 or PBB 153? Now that doesn't, just to be clear, doesn't answer it for farmers. Farmers got a very, very unique exposure back in the day. So just to be clear, I would not say, there's brochures out on the table, they look like this. This is not going to say, what it comes out with will be a population-wide in Michigan. It will not be, oh, this is what are in farmers today. So just, don't want to misrepresent or change expectations. So that's a really good question. Excellent thinking. Studies are ongoing. So that's what I can say on that. I'm not sure exactly. There was a second question about medical. Do you have something on that? I do not. So, like who informs the medical boards? I can't answer that. I don't know. So here's what I can tell you. There's a couple things. So, as was noted earlier, every university has an ongoing medical. They're trying to do medical education to doctors. CDC has, you can go, they also have, it's called environmental medicine. We promote that here in Michigan to doctors. We have a program that we go out and try to direct educate the medical community through grand rounds, through efforts to raise awareness. We partner and go on the annual basis to like the MoMA conference to be connected. But I would say it is a very, very difficult challenge to bring environmental exposure information to medical doctors, only because, well, there's probably many reasons, but here's one. The studies, as you said, let's go back to the study question. They look at populations of people, right? So you look at a large group of people and you find an association. You say, yes, we can find chemical exposure and an indication of harm. But what you can't do is then translate that easily down to an individual and say, what was their exposure? What is going to be their future health outcome? Or is the medical community set up to be able to say, oh, I have this condition, right? I have cancer. To be able to say, why did that happen to that person? So again, science has limits. The studies I'm 100% supportive of, but I also recognize that it becomes an unfair ask at some level to a medical doctor and expecting them to be able to answer questions that the greater scientific community cannot.
that civilized nations, maybe all nations, have with chemicals. They make our lives very easy in many ways. They provide lots of conveniences to us, and I doubt if we could easily get along without them and still maintain our current standard of living. But what we also have is a situation in which we've opened ourselves wide up to the potential for disasters such as the PBB contamination that took place many years ago. We recently watched as a train derailment in Ohio knocked the knees of certain communities that were living right along that railroad track. And it made me think that really it would be wonderful if we put as much time and energy as we need to in researching what's happened in the past. I would like to see our nation look more toward the future. What can we do not only to prevent accidents from taking place, but also to follow up on them responsibly? And I think it would be possible for each state to be required to have a contingency plan to follow. If we look outside the door of this auditorium, we see some kind of a vest which is used for people who are having heart attacks. And it has numbers to call. There's instructions on how to use that vest. And I thought, whoa, wouldn't that be a wonderful thing? If each Department of Public Health in every state, and every Department of Agriculture, and every department in which contaminations become an issue, has some kind of a set of contingency plans, information about chemicals and the way that they may or may not affect human health, the way they may or may not be able to be contained. What can we do in the future, not just by looking at the past, but using that experience to try to put together a roadmap for potential incidents that take place in the future? Thank you.
Could I try not to say another two questions regarding the medical question? So, in Michigan, licensed professionals have a licensure that they have to hold, and that would include medical professionals nursing. I have one for being a registered sanitarian. If there's a change needed, you'd have to go through your legislator, and then you'd have to lobby for it. But for example, last year, everybody who had a license and worked in say the medical field or the human health field had to do implicit bias training. 4 years earlier, we had to do human trafficking training. So if the need would be to get environmental medicine as part of this, then we'd have to go through the lobbyists to make sure that the legislature change and work with Alma to get this change. That would be one way forward. And we need to talk to our local legislators here in Gratiot County.
We may have to cut it there for this panel simply because we are actually a little bit over time already. We started just a little bit late. But I know people still have questions, and we will have more time to answer more questions. Also, I encourage people to talk a bit sort of informally here. But for now, let's thank our panel. I know I certainly learned a lot. Just a really amazing thing. Thank you also for all of your fantastic questions and all of your moving and important stories. I think we will take a short break to give you a chance to sort of stretch your legs, get some coffee, get some donut bowls, and as you're walking around, we have this art which was made by people in the Alma community after they had done a site tour of the Superfund site. So, kind of interesting. We'll come back at about 10:55.